So there's two ways to get a transplant. One way is from a deceased donor, somebody that unfortunately passes away in a motor vehicle accident or such things, or from a stroke, and we take those kidneys and we transplant them to somebody else, and that's called a deceased donor transplant. And the other way to do a transplant is a live donor transplant, where a wife donates to a husband or a mother donates to a daughter, and that's where we take the kidney from a healthy donor and we transplant into the recipient, who is either their daughter or their relative. And so that day is a very exciting day because we take that patient to the OR and we put them to sleep with an anesthetic, and then we take out one of the kidneys laparoscopically or robotically. And then once we take that kidney out, then we put that into a recipient and to the person that's receiving the transplant, and we put it into their pelvis. And it's a very exciting surgery because immediately these patients who are on dialysis, not making any urine for many years, immediately start to make a lot of urine and feel better instantaneously after the surgery. It's really very, very satisfying for both the patient as well as for ourselves as surgeons. It's a long day, but it's a very satisfying and rewarding day for us. Every time we do these transplants, we've done over 1,000 transplants now over the years, and every single one is always very exciting because it gets a patient off dialysis. They feel so much better. Patients are so grateful to be able to receive a transplant, whether it be a deceased donor transplant or a live transplant. It changes their life immensely. Being on dialysis is 3 hours a day for three days a week. It's very debilitating, and to be off of dialysis and have the freedom back is so satisfying for patients, and very satisfying for us as well as surgeons.